Hello there. Well, my name is Rafael Grossman, and I'm a surgeon. I also have this deep passion for how to use technology in a smart way in order to improve what we do in healthcare and what we do in education. For many years now, I've been exploring the fields of telehealth, telemedicine, wearables, how to use artificial intelligence algorithms in medicine, and also how to use gadgets that initially were designed and created for play, how to use those gadgets in order to potentially save lives. Back in the days when we were using iPod touch devices to connect different uh, healthcare centers of the telehealth network in order to provide acute trauma consultations, to when I did a TED talk in this theme that really made me think that as surgeons, we are innate educators and communicators. That started a career of discovering exponential technologies for an exponential era, right? 21st century already. That brought me to Singularity University and the Future Med program, which is now morphed into exponential medicine. There I met the inventor of Google Glass, and very shortly after that, I brought Google Glass to the operating room. It was the first time that an operation had been done live with the use of Google Glass, and all I was doing was trying to show students my perspective of the operating field and connecting with my students remotely to bring them to my perspective and to my point of view again, talking to them, answering questions, asking questions. So the potential of this device that was back then very sexy and popular to improve how my students would really learn. So that got me to become somewhat of an evangelist, a preacher of how disruptive technologies can be used creatively to transform how we do healthcare and education. I think that it's important that we think out of the box, that we jump out of the box. I think that it is really important that we not just practice that we not just preach that, but we also train the next generation of students, the next generation of providers to have this mindset, to have this mind frame. For the last several years, I've been topping tapping the field of virtual reality, right? What is virtual reality? Well, basically being immersed in a digital world, a world where you're completely isolated from the real world, but you can be a completely immersed in a an experience. Could be an experience to control your pain and your anxiety perioperatively, which is something that has been used for the last few years. And some of the pioneers on this are the Cedar Sinai people with applied VR and embodied VR and many other companies out there that are creating a immersive experiences in order to control pain and anxiety perioperatively. From that to trying specific treatments like PTSD, post-traumatic stress disorder. There's been an explosion of software applications. XR Health, for example, is got a great platform that is also been a successful business model, I believe, and also a very innovative way of engaging, patients, providers, and administrative, the payers, in order to make real interesting and positive use of these platforms to prevent and treat disease. From there, we can go to AR, right? Artificial augmented reality, where you basically have a digital reality superimposed to a physical or real world, and you can have devices, tablets, mobile portable computers like this one, smartphones with AR core or AR kit enabled, that you can see this reality basically through the screen, superimposed to the physical world. And when you can manipulate this reality, you get into what we call XR or mixed reality, right? So it's something that is evolving very quickly. When we talk about mixed reality, we have to talk about MXR or medical XR, medical mixed reality. I recently, a few months ago, was the keynote speaker at the FDA conference on VR in healthcare, and that term of MXR was coined. I think that this is happening, and it's just the natural progression of the of computing. Just like we had computers that filled up a room before with very little power, to computers now that are in our rings, that are in our watches, that are in our glasses. Like this is the View 6 Blade glass, which is basically a platform, so the evolution of Google Glass in a way. From a Google Glass, it could have been the Model T of AR glass, and now this is sort of a Tesla model, right? So if you think about that, we've gone really far. And spatial computing is sort of the culmination, the fourth era of computing, where computing was done in MS-DOS platforms, right? Black and white, typing on the screen, to the graphic user interfaces that the desktop, the Apple desktop, brought to the touch platforms that we still use today, in tablets and smartphones. But now to devices like, for example, the Magic Leap, right, which allow you to compute, right? Compute in this space, right? The space around you is your desktop, and you can have a electronic medical record screen here, and you have a radiograph or a CAT scan that you are looking at, or you are manipulating a 3D image, and you can be there watching a movie, and you can be there answering your email. So the space around you is a desktop, and you manipulate that space with interact with that space with gestures. That's what spatial computing is. So this is real. This is happening. This is not just a game. This is being used in all sorts of applications. Where from the VR side of things, you have companies like Fundamental VR, for example. There are other companies as well, but companies that are creating digital environments for you to try something before you become an expert, right? To increase your learning and your performance until you become an expert before you try on a real human, on a real patient. Just like the pilots would do that on a simulator flight. The same thing, but for surgery, for example. The incredible feature, I think, of that Fundamental VR offers is that not only you're immersed in the experience and you have a device in front of your face, like the Oculus Quest, for example, but you also have the possibility to share that experience simultaneously with other viewers. So they're all participating, you're all connected, you're communicating, but you are in a virtual space. And not only that, you can add the tactile component. Haptics is very important, I think. I think that the more senses you bring to the experience, the more real the experience can be, despite some literature that suggests that the learning is not enhanced by the haptic feeling. I really think that the more senses, the better. There are companies like OVR, which is a company based in Vermont, where you have a chip that you put on your set, in your Oculus, for example, set, and you can smell the world that you're seeing. Imagine if you can touch, you can smell. So when the experience is completely is totally immersive, then the better retention, the better learning, the better comprehension. And that has been proven clearly, not just the full senses, but the fact that VR improves learning and comprehension and retention compared to traditional education. Devices like the HoloLens, for example, that really can transport you like the magic leap to a real world enhanced with digital imagery, and you can interact with those imageries. You have companies like Philips and HoloLens that have created, and this is a rendering of that in the cardiac invasive suite. Dr. Atul Gupta demonstrating how you can have several screens in front of you in the space and not distract you from the actual the actual patient. By looking at a screen at a computer, no, you can have basically the screen in front of you as you need it. So I think we are going really very fast. The technologies are developing certainly in a very exponential manner, and there is no way that we can escape this, and we need to embrace these changes. We have to fully embrace these changes. Also, not just when we do medicine, but when we teach medicine. We need to change the way we teach medicine, we educate the next generations. And this field of digital health, these technologies of VR, AR, XR, wearable devices creating incredible amounts of data, devices that are commercial, that patients can wear, and they create physiologic data that then they can share to whoever they want, data to be analyzed. This is really something powerful and something important. You have devices like the Apple Watch or the Fitbit Sense that can check an EKG or can check a temperature. It can take your activity and your heart rate, or even your levels of oxygen, right? Imagine the potential for that. Imagine in a pandemic like this, and I'm involved in a study where we are checking the progression of my vital signs, my temperature, and symptoms, along with pulse oximetry, to see whether this would be a tool that could potentially predict early, or detect early whether I have been infected with COVID-19, for example. You have devices like the Omron Watch, which is a portable sphygmomanometer. Right? You put it on; it's just like a tracker, but it also has a blood pressure capabilities. You can check your blood pressure as often as you want, and not only check the blood pressure, but send that value to your internal medicine doctor, to a family practitioner, to your cardiologist, so that your therapy can be adapted to your reality in regards to your blood pressure numbers, not just one blood pressure every time you go to the doctor or a few times when you're at home or at the clinic, but a continuous almost monitoring of the blood pressure, giving a more real picture of what the real blood pressure physiology is. So there are many things that we have today that potentially can affect how we basically approach medicine. The traditional medicine of the past, the paradigm is being disrupted. Like Dr. Eric Topol said in his book, the Creative Destruction of Medicine, a few years ago. That book was followed by another book called The Patient Will See You Now, basically empowering the individual with all these gadgets and all these protocols and platforms to be in charge and be an active team member, a healthcare team member, taking care of their own disease process and their own healing process. That's very important. So, I think that we are right now at a very interesting inflection point in medicine. We have technologies like artificial intelligence, for example, which we've been using for years, but now they're becoming more more of a forefront breaking news every day. Seems like, AI protocols have been used for a long time in medicine. Even, we have alert systems that alert us of potential problems, alarms that tell us whether the patient is becoming septic, or reminders that the patient's bladder catheter has to come out to prevent infection, or a central line is not needed anymore. You can prevent sepsis by removing that line. Two protocols now that are basically suggesting treatments, suggesting oncologic treatments by reading the literature and all the data available, like no human could ever do, and suggesting potential treatments. Now, these protocols are obviously not yet perfect, because whatever data you put in the protocol, in the algorithm, that's the type of response you're going to get. So garbage in, garbage out, right? So it's really important that the data is accurate. But certainly, artificial intelligence is becoming more and more of a daily player in healthcare. If you see how image detection is much better done by computers, right? We have been using these systems in radiology, in dermatology, in pathology, for the last few years, and they become more and more powerful the more they're being used. And you have obviously the human input, right? Because the best system is the one that combines the computer or the AI platform with the human. I would say that computers and AI are better than humans, but computers and AI and humans are better than computers and AI systems. That is clear. And when we talk about whether the computers and AI systems are going to replace doctors, I don't think that will happen. But what it will happen is that computers and AI algorithms will replace the doctors who don't embrace these systems. That is very much for clear. And people say, how is this going to happen, or is this really going to happen? And I think it will. I think it will, because again, we need to embrace, and this is the reason for this talk, right? For this congress, for this conference, we need to embrace the technologies in a smart way. I always say it's not about the technology; it is about the smart use of the technology, right? It's not about a Google Glass that was created to take pictures of your breakfast, or you playing around, or in a concert, but it's a device that can potentially bring you to the medical record of a patient, and the technology that paradoxically makes you closer to the patient. I think that these devices can humanize, can help us empathize better with our patients, can humanize the medical profession. For the last few decades, maybe a couple of decades, we have had an explosion of digital health, and the digital health itself is very important and has had many benefits to healthcare in regards to the production and documentation and recording of data. But unfortunately, we have separated ourselves from the patients by using digital health. Every time you go to the doctor in countries like ours, or societies that are the fewer in the world, very advanced in the sense of using technology in healthcare. When you go to the doctor, you immediately are, basically, you have the doctor not facing you anymore. The provider in the computer looking at things and asking you questions. You're being separated, even physically, from the provider. Because of the technology. But if you use the technology in a smart fashion, then you can have devices like, for example, the blade, and you can have the computer information, the data in front of you, and the patient is there, and you're actually being more direct and human with the patient. Paradoxically, this technology can humanize how we do medicine, right? When you need the data is there. You're not looking at the data all the time and distracting yourself. Like if you're driving, you're not looking at the rear view mirror all the time. You're only looking at it when you need to see what's behind you. The same way, paradoxically, the technology is empowering us to be more humans. You can get closer to the patient, you can hug the patient, you can touch the patient, you can laugh, and you can cry with the patient. So the technology is making us better human physicians, and that is very important. And it is because of the smart use of the technology. So that is really very clear in my mind. There's no question about it. When you have systems like what Microsoft and Nuance have been created, the ambient clinical intelligence, where you have a room that has cameras and microphones and AI algorithms. And when you go to that room and you talk to a patient, you don't have to do anything else but be the best human doctor that you can be. And the system will recognize that you're doing an interview, that you're doing a history and a physical, and the system will start documenting and analyzing everything that the system is seeing or listening and populating a medical record. So you have companies like Augmetics that uses a Google Glass with a scribe that is remotely situated, and the human scribe is actually seeing and listening everything you're doing. And instead of you having to populate in the computer and record all the interaction, in review visit, you can go to the computer, look at the record that it's already there, and then basically edit, review, and sign, right? So it is giving you maybe not more time with the patient, but it's enhancing the quality of time that you are having with the patient. So this is very important. Again, the smart use of technology to enhance a human medicine, a humane medicine, I call it. We know that two-thirds of the world. And if you look at the Lancet Commission report from 2015, I think it was, 5 billion people, two-thirds of the world's population, don't have access to the healthcare that we take for granted, right? Especially in regards to surgery, we know that 5 billion people don't have access to safe and affordable surgery. And that is a shame. That is a shame because we have the technology, we have the possibility of changing this, and we have to, we must act in this regard. Healthcare is a basic human right, and we don't see it as such. We don't act as if that is true, except in time of elections, maybe. But I think that we need to think and have that premise in our head that healthcare is a basic human right, and that we ought to work and be evangelists and preachers of this cause in order to make it a reality. Um, I always say, healthcare is in trouble, and healthcare is in trouble shamefully, because today there's no excuse. Medicine, the amount of mistakes and errors that happen in medicine are shameful. Um, it's been said that 400,000 people die in the United States every year from preventable medical errors, for example. Some people say that number is not real, but even if it's one person who dies from a preventable medical error, that is one too many. I think that we really need to think about this, and we have the technology to prevent these errors. We have the technology to make it differently. The main problem in medicine is connectivity and communication, and we have the tools in order to improve and enhance how we connect and how we communicate, and that is very important. It's fascinating when we think about companies like Starlink, for example, which is basically blanketing the space around Earth with satellites that will create basically a network of internet to reach areas that never had that possibility. When you think about the potential of 5G with a much wider bandwidth and faster speeds to allow us to basically do magic, right? Exponential technologies, right? When 5G takes on for real, I think that it'll be really exciting. You have almost a year ago, more than a year ago, a group of Chinese surgeons did a remote surgery, robotic surgery, all wirelessly based on a cellular 5G network. I think it was 30,000 kilometers, uh, uh, 3,000 kilometers initially, and then uh, 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 basically whatever distance it was, they were able to connect a robotic device via 5G cellular connectivity, no Wi-Fi, no internet, right? And they were doing remote surgery in real time with an unperceptible delay, imperceptible for the human senses. So and that was almost a proof of concept, but it was actually a real surgery. So imagine where we can be. Imagine how we can extend the reach of the expert. We talk about telemedicine and we talk about telehealth and tele everything, right? We're trying to do telehealth for many decades, and suddenly within a week or so, the COVID-19 epidemic basically made it happen, right? All the barriers and hurdles and obstacles were suddenly, they disappeared. And now in many places of the world, in most places, telemedicine is being sort of rightfully and legally and smartly used in order to connect people, not just in healthcare, but in education and in entertainment and any other way of human endeavor. But in healthcare, it was amazing because we were trying to do it for years and we couldn't really do it right. And then suddenly, boom, everyone is connecting, and we are actually able or the system is able to monetize and to have a real a visit and a telehealth remote visit being built the same way, which is important, obviously. But it's really about communicating and connecting. I don't talk about telemedicine. I talk about telemedicine as the same thing as medicine, because the tele part is just another tool. I can see you by video. I can talk to you on the phone. I can send you an email. I can see you physically in the office. They're all part of the same spectrum of connection and connectivity between provider, surgeon, doctor, and the patient. We are connecting now by a screen, right? But now there are technologies. There's a technology called Beam, a company called Aetho, where we can bring avatars to a common space. So I can have basically a HoloLens device, right? Or I can have a Magic Leap device, and I can be in my operating room, and the Magic Leap device is basically bringing you one or many people, avatars, right? Virtual avatars, but virtual avatars that are physically located anywhere in the world, and that avatar is connecting with me, and we are actually interacting with the same digital and almost physical space. So the immersion of that meeting, of that connection, is almost real. The avatar has a real movement of the lips and the face and the upper body. So you are chatting with someone in your physical space through a magic device like the Magic Leap, for example, or even a smartphone or a tablet or a HoloLens too. And you are doing a teleconference with multiple players, all avatars, representations of real people situated anywhere in the world, as long as you have connectivity. And not only that, but you are also interacting with digital images. I can have 2 or 3 people in my operating room, and these 3, 4, X number of participants, we can all interact with, let's say, a 3D reconstruction of a computerized tomography of the liver, and we can all learn, or we can all basically have the same image, and from our perspective we can look at that liver and discuss what the best approach to the operation is. So it's almost short of teleporting yourself, like in the Star Trek a Star Trek a movie. I always say that science fiction is really the prediction of what's going to happen in the next few years, and that is true. We're almost sort of teleporting ourselves, and you can see this in here where this is actually a couple of years ago, a company called Ventana, VNTANA. They were live. Teleporting a hologram of a doctor talking to someone on stage, thousands of kilometers away in real time, almost as if the image was physical. So it is a reality. I think that we have to realize that technology is becoming more and more exponential, and we are going to be able to democratize access to global health in ways that we never thought possible before, but only if we really actively preach and evangelize and act upon the possibilities that we have today. Uh, One of the companies that I advise is called Nanox Vision, and Nanox is creating a portable, low cost, high risk enabled um, computerized tomograph, CT device. Imagine a device that costs $10,000 and is portable, and you can bring it to any location in the world, and you can have access to tomographic images, not through a device that could be hundreds of thousands of dollars and not mobile. Imagine the care, imagine the potential of accessing imaging diagnostics anywhere on Earth. That is the paradigm, changing the paradigm.
Hello, everybody. Thank you so much for watching us and watching this incredible video from Dr. Rafael Grossman. And I'm so pleased that we have now the chance to be here on a short interview after this wonderful set of images that we were presented. Amazing, extraordinary. What takes a surgeon like you, Raphael, to dedicate his life with such a passion to communicate, educate on health technologies and innovation?
Hi, Paulo. Thank you very much for this opportunity. Glad to be here. Listen, as a surgeon, we are educators, and as educators, you have to communicate, be a communicator. And for me, it's really not just a passion of mine and a joy of mine, but it's really a responsibility. I think that it is up to the healthcare providers, to the physicians and other providers, to really give a message of what's out there and what the problems are and what the hurdles and the obstacles and the frustrations and difficulties in healthcare are. And I try to see how technology used in a smart fashion can really improve and solve many of these issues in healthcare today, especially access to global health. I think that it is shameful that in today's age, in the 21st century, we still have the problems that we have in regards to healthcare, which, as I said in my talk, it's a human right, and not just that, but all the dynamics, all the processes in healthcare should be much better than what they are today with all the technology that we have available. So.
Definitely, it's amazing. But Raphael, so I understand that you have your own blogging activity. Is it okay that I can share your blog, because
Please.
I have here it I have here it separately from I think it's this one here. Um, It's a blog that you have created.
Yeah, it's it started as a blog and then morphed into a website. Again, it's part of the process of becoming a better communicator. When I did my first TEDx talk, years ago in 2010, I think it was. I saw what a powerful tool, to be able to connect with not just a few people, but hundreds of people, thousands of tens of thousands of people by the way of the internet, right? And then I ended up, I think I've done about 5 or 6 TED Talks, one of them in Spanish. And I figure, having a central site for like a website where every once in a while, I wish I could keep it more active because I have to write it, but I'm so active. I mean, I'm a full-time surgeon, but I try to do a lot of webinars, and I used to do a lot of global talks, all over the world, traveling before the coronavirus. Hopefully, we'll get there again. But so I try to. It's a repository of things that I've done, that experiences, insights. There's an educational tab. All my TED Talks are there, and there are interesting links and apps and companies that I find interesting, or companies that I advise. Or it's really a non-commercial site. It's purely for the fun of communicating about the exciting technologies, exponential technologies in healthcare today and education. So yeah, it's a lot of fun to do it, and very happy to have people check it out and comment and give me some feedback. And also, I'm very active in LinkedIn, as you know, and also in Twitter. My Twitter account is very active. Everything I get, pretty much I get from Twitter or LinkedIn, as well as everything I share it in those 2 platforms. So always tweeting about videos and cool platforms and things that are exponential, things that are not very common, all related to healthcare and education with exponential technologies.
Fantastic. And Rafael, I know that you are a busy schedule today because you're probably going back to surgery room in a few minutes. Just to get do you believe that COVID is going to have an impact in healthcare, and how do you see that impact going to take us forward?
Yeah, absolutely. It has had an amazing impact already in healthcare, in many, many layers of healthcare delivery and planning. Just talking about remote connectivity, healthcare, we have had all the tools to connect remotely for decades, right? And we never did in the way we are doing now. And it took the COVID-19 pandemic to really, reverse all these hurdles and obstacles that were there, not just in the US, but in many places in the world, to suddenly engage and increase the telehealth, the telemedical connectivity, thousands of percentages. That's one aspect of it. But I also think that as we see COVID developing, the amount of global brainstorming, crowdsourcing of ideas, of innovation, the creativity from apps to the development of PPEs, to the development of potential treatments or drugs or vaccines or ventilators. It's been really amazing. Using simple tools sometimes to communicate, from Slack to WhatsApp to Telegram, to the amount of activity out there is just like incredible. It's all about COVID-19, and I think that obviously once this terrible nightmare is gone, or at least gone in the way we are seeing it and living it now, I think that the leftover is going to be a much more solid a platform of connectivity and communication to fight any disease or to prevent any disease. And the amount of progress that we have made, I think, in the last very few months, it's really truly exponential compared to what we were doing, the pace we were taking before. I can't hear you.
Sorry, just this morning opening session, we have a conversation with some colleagues of yours in the US. They got up really early to be in the opening at 9:30 UTC. here with Suzanne Gaunt and Charles Alesi from IMS, and Suzanne Gaunt, the CEO and president of ISHOM, as well as other colleagues of yours and chief medical officers. And one thing that was raised is that there's currently in the US the lack of trust on data shared by big players like Apple and Google. People don't trust their health data on these big players. Is this the case you also experience, and why is this happening?
Yeah, I don't know if I experienced it or not. I just read that in the news, and I think that it's all been data privacy, right, and personal privacy has been a revolving issue, for a long time. And as the companies gain access to more and more data, and we have more, more devices, that gather data, and then you either trust or not trust, and then there's a lot of media coverage, some of it good, some of it bad, and I think people at the end have to make their own decisions. But then, as you see other aspects of data sharing, and how, if you put aside healthcare and you talk about politics, for example, the amount of distrust and mistrust and manipulation of behaviors, and the targeting of certain groups based on their data analysis has been such that people obviously is, I think, mistrusting, the big corporations. But at the same time, I think that, I don't know the objectively, the numbers to say, oh, people distrust the big players. If you ask me, everyone has seems to have an iPhone or an Android phone and some sort of watch, or a Fitbit Sense or an Apple Watch, or some sort of a wearable that is connected to their devices, which is connected to the cloud, so people distrust data, and at the same time, the amount of data being shared willingly, it's insane. So I'm not sure how real it is that people is not trusting that. I see a lot of big players in healthcare that are gathering data from wearable devices that are devices made by some of these big corporations, right? I think that when we talk about Apple devices or Google, or devices, Android devices, Fitbit devices, I think that it's a bit different than what we see with data shared, let's say, in platforms like Facebook or Twitter or WhatsApp or Instagram. I think that it is a little bit of a different game. I know a lot of people, including myself, who basically shares physiologic data, with the big players. In my case, I have an Apple Watch. I have a lot of wearables because I love to kind of compare them, right? So I have an Apple Watch. I've been measuring my pulse oximetry on the Apple Watch and sharing it, right? And there's many studies that are happening, and I basically share my data willingly, because that's how the science will evolve. I think I have a Fitbit Sense, and the same thing. I have an Oura ring, so I have a lot of wearables that send data to the cloud, and all being analyzed and used to create better hypotheses, or to at least create conclusive studies that could make health care better at the end.
Definitely. So definitely, you trust that science will benefit from this data sharing.
Absolutely.
And that we should all be doing our part on doing this data sharing, and definitely. How about your patients, Rafael? Do you have some sort of connection, that data connection with your patients, with wearables that they use that feed you directly to your own information system of your practice. Tell me a little bit about that and how you feel that that's going to be more and more part of everyday doctor life, being a digital doctor.
Yeah, I personally don't. A lot of my patients have devices, and they share the data with me. But not it's not part. I'm an employed physician, so it's not part of our hospital's sort of a system. But at the same time, our hospital system, especially not so much the surgeons, but the primary care providers and the general practitioners, they have ways to connect wearable data from different apps or devices to the healthcare record. I can put, for example, my healthcare record in Apple Health, right? If I want to, and any patient can. So in that sense, it's very connected. I think there's that level of trust right now that this is happening, and I think that this is definitely going to be the future. There's no way that all this data is going to be just lost to be analyzed in patients or to be shared in Instagram and Facebook only. I think that there is a very clear need for the continuous, in a way, data to be populating the cloud healthcare records in order to have a better picture of what your health or not health is. So I think that this is definitely the future that is becoming more and more clear, slowly, but definitely surely.
Definitely. And I realized that you have a very unique LinkedIn headline, like you're so proud of being an immigrant, right? And I see that you have a flag of your country. Yes, you're both an American, but come on, you're more an American now than anything else. So
Oh no
is
no
this?
no 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 no! I'm Venezuelan 100%. I live here and I'm a citizen of the U.S., but my heart is. Anyways, I think that I'm a global person. I happen to have two nationalities, but I'm a global person for sure.
Definitely. So that will be really, really good. That hopefully COVID will allow us to travel, and that's probably fine way to you having you here next year in our physical Health Data Forum Summit. We're
I
planning a big event for next year where we were going to have the Portugal will be the presidency of the European Union. So
Yeah,
we're trying to make something really meaningful happen, and it will be really great to have you here.
I love to.
And why not also visit neighboring Spain, where you will be much comfortable, because obviously it's your mother tongue after all, right? Spanish, not English, right?
Yeah, correct. Yeah. I was born and raised in Venezuela. I just came to the U.S. to train, and then I went back to Venezuela after training surgery here for 7 years. But then unfortunately had to come back to, get out of Venezuela. It was a difficult situation back then, as it is now, and basically settled me and my family here. But all my family lives there, and I have many friends also, obviously in Europe and all over the world, but especially Spain, Portugal, and Latin America. It's I have many Portuguese friends, and very I love Portugal. I think if I go visit, which I can't wait to do, I probably stay there for longer than I need to.
It will be great. But tell me, Rafael, just to complete, because sorry, we have nearly reaching the top of the hour, and Grossman, that's German, and you have also a German origins, and I think it's a third generation of doctors in your family.
Yeah,
Am I wrong?
I'm actually the sixth generation of my family's the first immigrants who came from Germany to Venezuela, to the New World, in 1800s, in 1811. My first relative there came from after finishing the Prussian wars against Napoleon. They wanted to do something, and this 20-some-year-old kid and a bunch of other people, he was a physician back then, came to the New World in the Amazon, and became actually a fighter and a physician with the Bolivar Liberations Army, against the Spaniards. That's 6 generations ago. So I've been, my family's been there, and many of them physicians.
Fantastic. So thank you so much, Rafael, for being here with us. It's really, really a pleasure to have you here. And stay tuned to Rafael Twitter account. Stay tuned to Rafael blog and website. Definitely you'll benefit from his postings and contributions. Thank you
Thank you,
so much, Rafael, and thank you
Have
for
a
the
good one.
wonderful video.
Be
Take
safe.
care. Take
Bye-bye.
care. Bye.